Welcome back, everyone, and welcome to our final closing keynote. It is an absolutely immense pleasure for me to introduce our closing keynote speaker, Mr. Hal Wolf. He's the president and CEO, and might I say, the fearless leader of the Healthcare Information and Management Systems Society, well known worldwide as HIMSS. HIMSS is actually an extensive, very large network that includes HIMSS North America, HIMSS International. It's a cause-based global membership of societies, HIMSS Analytics, the Market Research and Data Services Group, HIMSS Media, the Diversified Media and Publishing Division, Personal Connected Health Alliance, Health 2.0, the Digital Health Conference, all of which come together and drive better health for the global citizens through leveraging information technologies. Hal has well over 3 decades of experience. He is one of the most respected international leaders in this space of healthcare informatics, particularly with areas of expertise that span mobile health, product development, integrated care models, marketing, distribution, IT, and implementation and innovation at scale. He's worked with some of the world's leading health systems and providers with end-to-end operations, commissioning, data, and architectural design. Before joining HIMSS, Hal served as the Chartist Group as Director and Practice Leader of Information and Digital Health Strategy. He was a key architect in the development of content research, user interface for video on demand and broadband. He was also a pioneer of consumer engagement, has contributed a very unique approach and insights into the emerging and birth, really, of the digital health area, bringing traditional enterprise strategy with an end-to-end organizational view, keeping the patient as that very, very central focus. Not surprisingly, HIMSS' whole digital health ecosystem has that patient very much front and center. Hal served as Senior Vice President and Chief Operating Officer at Kaiser Permanente Federation, representing more than 16,000 physicians. He there was responsible for the development and implementation of critical care delivery strategies, data management and governance, population care management environments, and implementation of unique innovations at large-scale program that brought end-to-end operations and impact, well known around the world. Prior to Kaiser, he was Vice President in e-business, Chief Information Officer of the Corporate Systems and Wholesale Division of Quest Communications. Previous work internationally in deployment of interactive television services and operations, content and business, senior business management positions with Time Warner and MTV Networks. I think you can get a sense of the incredible breadth of expertise Hal brings to us today. He is also senior advisor to McKinsey & Company and former vice chair of the HIMSS Enterprise Board. And he will always share with you that he's a very proud alumni, Bachelor of Science in Business at Wake Forest University, and a Bachelor of Textile Management in North Carolina University. So Hal, we are so grateful to have you join us today as our closing keynote, and we just cannot wait for your presentation, and we'll follow it up with a Q&A. Thank you for joining us.
And thank you for that incredibly warm, if not overly lengthy introduction. I was listening to it and I was getting tired. Now I know why I'm tired, but more importantly, I look up and I see the amazing work that HIMSS is doing and all the avenues in which we're working so hard to pursue the improvement of health for every person everywhere. And I just want to say what an honor it is to be here today and an absolute pleasure to welcome this incredible SCAN health community. And as you announced earlier, especially into the HIMSS family. We're very, very excited. We have so many pressing issues in healthcare. And this really allows, I think, the whole ecosystem to unleash one of the most promising and improving care quality and outcome opportunities we're ever going to have. The context for all of this work and all the incredible presentations that we've been hearing today, it really couldn't be more urgent. The novel coronavirus that emerged from a live animal market recently spread across the globe overnight sickening thousands and affecting travel, business, and global supply chains. In that process, the disease that sprung forward cast a bright light on a wide range of failures in our global, national, and local healthcare systems. Everything from gaps in disease surveillance, testing systems, shortages of emergency care capacity, the limits in access of data needed to make informed public health decisions, weaknesses in supply chains that hampered access to essential medical equipment. But before we all jump to conclusions, what I was really talking about was the SARS pandemic in 2003. 8,000 cases in 29 countries and nearly 800 deaths. And yet it offered many lessons. And yes, for a brief period of time, it seemed like we may actually build on what we learned and create a stronger, more resilient health ecosystem amongst our healthcare systems itself. Reports were commissioned. In the US, the Strategic National Stockpile was established. New funding was allocated for research and disease surveillance. And then we just kind of moved on. So here we are, 17 years later, and another coronavirus has emerged and swept across the globe. This time the cases are in the tens of millions. Nearly 1.5 million people have passed away. The disruption in our lives and our economies have once again cast a bright light on the gaps in our healthcare systems. And tragically, the list of failures are almost identical to the list that was compiled in 2003. We cannot, we must not make this same mistake again. So that's why I'm actually excited to be speaking to you today. While this incredible potential that we have to drive transformation for the healthcare industry has come together to rethink, re-architect, and reinvent healthcare supply chain is so important. And for all the disruption, sickness, and death, there's reason to hope that we have a lot of good opportunities to take from the experiences we've had this year. Because in response to this incredible crisis, especially by heroic frontline healthcare providers and governments, beginning to see that the pathway towards a better future of healthcare is possible. Over the last 9 months, we've had witnessed a tremendous increase in the use of digital health solutions, including telehealth applications, electronic health records, digital devices, and population health databases and analytic tools. It's clear to everyone now that digital technology is essential to our ability to detect, treat, and manage not just highly infectious diseases like COVID-19, but impact an entire range of health challenges we now face and will need to confront in the coming decades. That's why we've seen that the best response to COVID-19 has come where there were coordinated systems for collecting, sharing, and analyzing data, where systems have redesigned their care delivery models to enable people connect with clinicians remotely, and where effective rapid response capabilities have been built on robust testing, tracking, and tracing. To make these things possible, governments, healthcare systems, and clinicians have embraced new digital tools and new ways to think about how care is delivered. It's driven by necessity, and caregivers who have been resistant in the past to digital solutions like telehealth and even remote monitoring have incorporated them into their practices. Clinicians, researchers, health systems, and public health agencies are harnessing data and analytics in new ways. And governments around the world are revising rules and regulations that have limited the use of many of these innovative technologies in healthcare. In many ways, I believe this marks the moment where we begin to realize that the mission we've been working for years at HIMSS to reform the global health ecosystem through the power of information and technology is truly having a light shine on it. And as much as anything we can do to continue to drive progress, developing a new generation of integrated digital supply chain offers the greatest opportunities for transformational impact. This is because we know now, thanks to the incredible work that you, Anne, and the entire SCAN Health community has done, that with the right technologies, the right processes, and the right methods, health supply systems and health system change can make much more of a change than just what's happening in the storeroom shelves with medical supplies at a lower cost per unit. It's much more than just a tool for making sure we have enough masks and gowns on hands to the next health crisis. Today, we have the opportunity, we have the obligation to transform healthcare supply chain into a critical source of information about the quality and outcomes, appropriate interventions, and the orchestration of care delivery, workforce capacity, and facility usage. I believe that the clinically integrated supply outcomes model, we have the right vision to achieve this and a clear path forward to get there. Already, we've seen great examples of healthcare systems, many of which Anne went over earlier, in the use of SciSom, whether it's the Orchard Health System in Louisiana, Mercy Health in St. Louis, Alberta Health Services in Canada. But we still have a lot of work in front of us to get there. So let me be blunt for a moment. Here in healthcare, when it comes to supply chain, we have lagged behind nearly every other industry for many, many years. It was a quarter century ago that the retail industry made a huge leap forward as it figured out how to integrate supply chain all the way up to what was happening on the shelf of the store and in the stockroom. Instead of buying a pair of jeans from the factory, the actual transaction would take place at the moment of checkout. The moment a customer actually bought the product, its ownership was transferred from the manufacturer to the store to the customer. All done in basically just-in-time transaction. And at that point, the manufacturer would suddenly receive information that their supply chain had to be backed up. It would immediately go to the cutting room, and literally a new pair of jeans would be manufactured as another was shipped to go ahead and fulfill that supply. Now, this was a transformation in retail, and I grew up personally inside retail stores in a multi-store environment, and we learned a long time ago that control of inventory is the lifeblood of any retail situation. Too much of it, and it'll cost you a fortune. Too little of it, and you do not have what you need to supply. Now, integrating information from a cash register in storerooms, it's important to understand how those pricing models can impact you. And we saw where savings would take place in healthcare systems, just in one of the examples that Anne used. But healthcare goes much deeper. It's not about the cost of a unit that is where we stand to gain some of our greatest strides forward. It's about what happens to those units. It's about what quality they bring forward. A reliance on a single provider, as an example, can create a shortage of personal protective equipment when we needed it. The cost of a particular item, it's important, but let's go to where we really can be. The good news is we're finally learning how to do things. We're learning how to build integrated supply chains and connect a piece of equipment to the outcome of an individual patient and then tie it back to the manufacturer. By doing this, we can make better decisions, not just on costs, but on care. Achieving this begins not with just knowing the price, but more importantly, answering the essential questions around the population health. Questions like, what are the demographics of the patients in my healthcare system? And how does that expertise of my own medical staff align with their needs? Questions like, how many surgeries do I anticipate? For what diseases? And what supplies will I need in the OR to orchestrate those surgeries? Questions like, how many childbirths will be coming forward? In effect, taking an actuarial point of view in anticipation of the supplies I will need and have multiple sources from which to draw. But then it goes even deeper. The example on the infrastructures, we begin to understand the questions of quality and their outcomes. Knee replacements, for me, have always been a very good example, and one that I was able to track and be a part of. Every time there's a knee replacement that takes place, that particular part needs to be scanned, as we know, as it comes off the shelf and associated with a patient record, so we can track the results. If there's a recall, we know where to go and where a new knee would have to be replaced. But more important than that, every time we do a knee replacement, it adds to our knowledge of the type that needs to be integrated with a particular similar patient. We know that it probably doesn't make sense to put a titanium knee into an 85-year-old's body when the plastic ones will do just fine for the duration of their expected lifespan and lifestyle. We do this, and we come across the line each and every time in our ability to treat individual patients so that we can make decisions that work under what is best for their particular circumstances. These simple examples will revolutionize healthcare. That's our priority, that's our opportunity, that's our goal. So it raises the obvious important question: how do we get there? Well, ultimately, it's a matter of digital maturity. It's one of people, process, and technology. It's of building the interoperable digital infrastructure to connect every patient, access comprehensive population data, and apply analytics and machine learning to understand the connection between outcomes and products. It's a matter of creating connections between the health systems and vendors that share information and best practice, and it's a matter of working with policymakers to create regulatory frameworks that are critical to making this all possible. Now, this is where each and every one of you come in, and it's a reason that this event is called the Path Forward. Gathered here today is the knowledge and the expertise needed to lead the global effort to advance digital supply chain strategy that can better drive outcomes, create more efficient and effective global healthcare ecosystems, and is truly built to realize the full potential health of every human everywhere. Together, the Scan Health and HIMSS communities frankly offer a powerful peer-to-peer environment, sharing information and best practices. And I'm awfully proud that we'll be able to continue that incredible partnership moving forward. The time could not be more critical. Manufacturing, distribution, and administrating COVID-19 vaccines, by the way, will be one of the most complex and difficult supply chain challenges in the world healthcare systems have ever faced. In the coming months, hundreds of millions of vaccines will be distributed to hospitals and clinics around the world. And we're going to have to track each dose by lot, batch, date, and site of manufacturing. We'll need to account for storage and shipment and conditions of the vaccines, and we'll need to know who is high risk and ensure that everyone has access in the right order of priority. And we need to know what we have to do once the inoculation has taken place and who has had the need for a second shot depending upon the vaccine they have. We'll need to understand levels of duration of immunity, track adverse effects, and link all the data to health information about the individuals so that we can understand which outcomes are the best result for those individuals and those segments, all the way down to the genomic composition of the person. So our stakes could not be higher. How quickly we manage the COVID pandemic and to fundamentally will rest on the strength of our national, our global, our local healthcare supply chains. With SciSom, which we're so proud to have helped develop and work with Anne and the entire SCAN network on, we offer a path forward to ensure that the healthcare systems around the globe and the supply chain capabilities will be ready for what is going to be an incredibly critical year. And with the incredible expertise that each and every one of you offer and play a central role in these capabilities now, we're going to be laying down a foundation for more effective and equitable healthcare for everyone. I see this both as one of our greatest opportunities and one of the most pressing responsibilities. And I'm honored to work with each and every one of you to continue to advance this work and the urgency that it demands. So with that, again, I just want to say thank you for having me today, and I look forward to answering your questions.
Thank you so very much, Hal, for giving us many, many, many things to think about. You highlight no shortage of next steps and key drivers of the future for global health systems. Within the context of this pandemic, I don't know of anyone who hasn't felt that overwhelming sense of where do we start? Any thoughts on your travals, globally, health systems better than anyone I know. What would you say are the key one or two places that any global health system today could drive forward on to, at the first point, get in the right space to administer this vaccine successfully and move forward on so many levels that you've identified?
Yeah. And it's a great question. I mean, first of all, of course, just like you and just like all of us right now, I've been limited to our Zoom connectivity. Last year, this is not a badge of honor. I think it's almost a sign of insanity, but I flew somewhere around 325 to 375,000 miles last year.
Wow.
Multiple trips, literally starting in the United States and going around the globe. What I have been talking to people is that the disruption and the change has truly been, and as I mentioned earlier, on this understanding that the digital health capabilities and frameworks that have been available to people for quite a while, some of them have been resistant. I mean, healthcare in general in the ecosystem, we're terrible at innovation. We're terrible at moving fast. We just don't do it very well until there is a burning platform, and we've had a big one. So I think that what I've seen is that the healthcare systems that traditionally have created platforms of innovation and can scale have been able to do so very rapidly and to move people from the classic encounter environment, to the virtual environment. And then some of them are swinging back, excuse me, because what you have to be able to do is follow the money in the reimbursement programs, which basically compensate physicians, clinicians, et cetera, for the use of those telehealth environments. So we need to follow up, number one, on that. The systems that had to come at it from scratch or barely had experience, let's grab a little water. For those environments, they've taken a whole new approach. They've taken an entirely new position that allows them to really use telehealth new. They've thrown a lot against the wall, and now they're working on strategies to make it better.
I think you raised so many important issues here. The burning platform and the legacy of SARS. I was the chief nursing officer during SARS. I remember that as clear as yesterday. And to your point, when I read through the legacy of what SARS taught us, it's almost as though I'm reading through what every health system is going through today. And the learning those really hard lessons. Do you think it was SARS wasn't as significant a burning platform as we're currently facing? Was that why we didn't make some of these investments or changes in process? Or do you think it was about learning? Because you also identify, with this pandemic, we watched every global health system, like country by country by country, manage to the best degree they possibly could this pandemic. Is this also about systems learning from each other? It would seem to me like key drivers that all of us respectively could get behind and mobilize to make sure we never waste this crisis, and the learning and the embedding and scaling in systems actually happens, like starts and doesn't stop. Any thoughts on that?
Yeah, first of all, you raise a great point. We did get a lot of learnings. We
Right.
knew exactly what was going to happen. What I think healthcare systems have a tendency to do is we learn and then we work very hard to forget. I mean,
Yeah,
it's
yeah,
astounding to me that we do that. I think that many healthcare systems, and I hope they do this going forward, you have a crisis, you learn from it. And then how many times a year or at least every other year do you sit back and review your crisis management planning?
mhm,
Do you sit back and say, what happens? Now, every healthcare system in the country faces a moment in time during flu season where, they're facing ramping. They have ambulances out the back end and they have ways to cope with that and they review it. This was a classic
yeah,
part of
yeah,
operations. I've done this in Australia. I've done this in the UK. I've done this in Germany. I've done this in Singapore. I've gone this many countries where you sit back and you think about what will be our response in this case.
right.
But frankly, we think about it in 1 or 2 week increments. No one had really processed in their heads a 9-month siege that we've been going through. So in fairness, that's been to the extreme, but that is what crisis planning is. It's
Right.
planning for the extreme, not just what we know. So I think that if there's a critical lesson that comes away from this, it's that we have got to be prepared
Yeah,
for crisis management and practice it on a regular basis. Now, to practice it, we need to understand all the pieces that go into it. What are our foundations? What are the dependencies against those systems? What happens if our supply chain is disrupted? What happens if we do not know how long this is going to be in a sustained manner? So if there's a lesson, it's that you've got to practice to the extreme and be prepared for it.
yeah, and hopefully that is a long-lasting legacy of this pandemic. In the research I've been conducting, if there's one thing that's pretty clear, I haven't found anyone who doesn't tell me, and we will never let this happen again.
Yeah.
Because moving through such a devastating wave after wave on this pandemic, perhaps that is that burning platform that will have a very, very long history in people's memories, but also motivations to drive momentum. The shorter term challenge today that every system's figuring out is the supply chain challenge around vaccines. Any thoughts on if we were to, based on all the things we know about integrated supply chain and the critical opportunity, not the vaccine, but the vaccination process can achieve to protect the global citizens? What are a couple of the key things that health systems could be or should be really making sure they don't miss in taking on this vaccination strategy and process, which will be pretty significant given the numbers of people, the numbers of doses, and all the many things that this vaccine strategy will require to be successful.
Yeah. Well, this is going to be a massive enterprise. There's so many.
Yeah.
Let's start at the population health level. What is our critical mass targets? Where do we need to be so we start to recognize that there's a downswing in admissions and we start to get this under control? Is it 70%? Is it 80%? How do we get all the way achieved to 99%, or if we were very lucky, 100%? So we've got to look at this from a population health standpoint.
Right.
The problem we have is our population health backend databases are not very good. We saw that in the reporting of the current circumstance we're in. There's too many phone calls, too many transfers of files.
Right.
So one of the things HIMSS has been doing in the US as an example, and in Europe for that matter, is working to make sure that investment is taking place on the back end, country by country, in order to have a more fluid environment from a data standpoint. I personally serve on the WHO Technical Advisory Group, and we've been working on exactly that. How do we collect that information to bring it forward?
Right.
So the distribution of a vaccine has to be tracked at the individual level. It needs to be tracked at the community level, the national level, and the global level. So that's step one, which is so critically important along those lines. The second problem we're going to have in this particular issue is validation of those that have received the vaccine.
Right.
Assuming whether it's 1 or 2 shots, or if they move in their location, how do we track them? We mentioned this earlier today during the panel component, like in the US that doesn't have a national patient ID to actually track where a person has gone. But I actually think tracking individuals globally, we're going to need to have some type of vaccine passport, if you would, that an individual can carry around with them in order to designate that they have received immunization. And I actually believe that we'll reach a point in time where to get on an airplane, to go into a restaurant, in order to engage in normal components of society, you're going to need to have that passport. Now, there are going to be some people that push back and say, I don't want to take a vaccine. Well, that may be a choice that you can take, but there will need to be consequences within society of what you can and cannot do. Now, keeping track of all of that starts with supply chain of what is important.
Yes, and we're right back where we started.
Right
Absolutely.
back where we started. I mean,
Yeah,
it's
absolutely.
a fundamental beginning dependency. And you know, Anne, one of my favorite words in life is dependencies. You have to look in healthcare through that window of what are dependencies necessary for us to have a successful system, a successful deployment. And it's all going to start with supply chain, tracking it all the way through to the end state. And then finally, let's also be clear and fair. We are working very hard at light speed to understand the efficacy of these vaccines that go forward. If we can't trace it back to the individual, if we can't look at it through the outcomes and the interactions, and ultimately do mapping back genomically, much less, the social determinants of health and the access to it, it's all going to come back together. So we have to be incredibly vigilant, which is why integrated supply chain, even in the case of this vaccine, becomes intimately important at the individual level.
No question, and I have a question follow on to that, which I think is a critical one. Should health systems be really creating those collaborative relationships to move this forward together, or do we rely on what we've been doing for a very long time, Hal, and that's internal competition? The smartest group or the best proposal wins. Health systems are competitive, particularly in some jurisdictions. US is one, but Canada's not immune from the competitiveness either. What's your thoughts on that? And I apologize, we're almost out of time, but it's such a critical question. I can't ignore it.
Yeah, well, the definition of insanity still remains doing the same thing over and over again and expecting a different result.
Right.
Look, the competition needs to be how well we can deliver on behalf of our patients.
Right.
And we need to share best practices rapidly as possible. But we also need strong guidelines from our governments and systems to ensure that we have an equal and fair balance in terms of the social determinants and distributions as well. So I think it's critically important that the healthcare systems share, communicate. We're not out of the woods by any wild means. We have centers of excellence that need to share with each other, and we need to be able to respond accordingly. Here's a quick example. We're all aware that some of the vaccines, the Pfizer one, for example, can only exist at 95 degrees Fahrenheit, minus 95 degrees Fahrenheit or less, right? So it's being shipped at 100 degrees negative Fahrenheit. Right. That's not going to work in rural communities. That's not going to work in clinics where we have got to have it. So even part of the distribution challenge is healthcare systems that have the capacity to take in the very deep freeze necessary for that distribution. That's where that product needs to go. Then you go to systems that don't have the same facilities. So if these systems aren't talking to each other and figuring out that distribution pattern, you're going to jeopardize communities. And then suddenly there will be gaps that exist. So they've got to work collaboratively, not in competition. And we're going to need better supply chain and population health databases and analytics to guide us.
So perfectly stated to round out our final keynote and our last presentation of the path forward, how a population health lens and agenda built on collaborative networks, we're all moving together, moving forward together so that every global citizen has that opportunity, whether if they're in the rural environment, you couldn't agree more. The cold chain version of the vaccine may not be the best one. So it's almost a personalization of vaccination at a population level that you're really identifying, which I think is something all of us need to think about, contemplate. How do we get behind an implementation strategy that will be so critical to the health and wellness of virtually every citizen, regardless of where we happen to live? So with that, Hal, thank you ever so much once again for joining us, sharing such an inspiring and visionary way forward to the future. And I know all of us will very, very much look forward to joining that HIMSS network, to making that a reality. So thank you ever so much. We are so grateful to our partners for supporting this conference. This is our final event as Scan Health's annual event, and we are now, you'll be hearing lots more from us as we transition to the HIMSS network in the new year. HIMSS and GS1 Canada so generously supported literally every step of today's meeting and conference. And I know you'll agree that the incredible insights everyone has shared in the dialogue, the questions, the panel speakers, the keynote we just heard, give all of us, I think, the many, many things to think about, the key lessons learned from all of the global jurisdictions that participated today. And that really fuels the path forward to achieve the many and overcome the many challenges health systems face today. I think to wrap up some of the key themes we heard, the art of the possible, the ability for global health systems to mobilize and achieve, they really have achieved extraordinary outcomes in managing such an unprecedented pandemic as we're all seeing, mobilizing that tremendous resilience now, bringing it forward to a learning global community is absolutely critical to achieve the many, many next steps that Hal so generously shared with us today. The role of a robust, resilient supply chain infrastructure that regardless of what faces a health system, it's prepared and it's able to meet those demands. The very, very important work of advancing digital maturity, supply chain capacity, building confidence in our health workforce. We heard that as a key theme today. Our the health and safety of our workforce tied to making sure they feel confident that they have the protective equipment they need whenever and wherever needed as they deliver that incredibly important care. That actually, that digital infrastructure, digital maturity also creates the transparency that identifies where are those inequalities, who are we not achieving the best outcomes, where can we learn from the population segments that are doing well and improve those who aren't achieving the outcomes we would all like them to. That kind of data and evidence and insights drives, I think, what meaningful engagement with the patients and the families, the communities, and just as Hal shared with us, those populations that we need to come together and work forward as it will take every one of us to achieve the incredibly important outcomes that clinically integrated supply chain offers and to achieve the many, many strategies and innovations health systems are going to need now and well into the future in order for them to continue to help every global citizen to have access to very high quality and safe care. So to sum up, an incredible event, and today I have many, many, many people to thank. First, for sure, our speakers, David Berridge, Joe Drozda, Kevin Fenton, Martha Houston, our board chair, Eileen McDonald, Susan Moffat, Bruce, Hal, Verna, you've just made today the incredible success, bringing your brilliance and your expertise and your wisdom to a very, very challenging time that I think every one of us today are experiencing in this pandemic. Special congratulations to Rich Casera and his team at Symmetric Health Solutions for their winning of the design competition, and to Radley Bradley and the Haslam School of Business, the team from Intelligent Automation and Southeast Health in Alabama. We're so grateful that you participated and brought a critically important solution forward that I think we've all learned from today. The design gen wouldn't have been possible without the support of Ron Johnson and his drive to find the solution to support Eastern Health. The moment Ron identified it, many, many other health leaders said that's exactly what we need. So he was one of many facing that challenge. And Jay Myers from NextGen Manufacturing that brought a completely different lens, but critically important one to that design den experience. So thank you all very much for a very, very successful design competition. Today's event simply would never have happened. Pivoting from what we originally thought was an in-person event to now a virtual event without the incredibly hard work and leadership of the Scan Health team. Lori Turk, our Chief Operating Officer, Catherine was all things path forward and answered every question of every speaker and every logistics, and Chris Smith, of course, managing all of this technology and the tremendous organization behind it. Thank you, thank you. The GS1 team worked with us from the start. Alicia, Kai, Allison, Rena, Maria, Jill, the HIMSS team, Devin and Kyle. I'm so grateful for your time, your energy, your willingness to go through the many, many challenges in putting today's event on. It is just a tribute to the phenomenal work of this team, and we're all very, very grateful. To all of you, I know you are on Zoom a lot, as we all are, and I can't tell you how grateful I am that you've joined us today to connect, to collaborate, to contribute to the dialogue, to ask those great questions. As every one of us recognize the urgency and, quite frankly, that critical legacy of key lessons learned to make sure they are never lost and they're embedded in our health system's DNA, so that every health system in the world moves forward, learns from them, makes those critical decisions that will overcome the many challenges, not just of today's pandemic, but on future events, whether they're epidemics, disasters, or many challenges that can happen at any point. We will be posting all of these sessions online in the coming weeks. We'll keep you all informed of when you can access them. We'll also be reaching out to you for your valuable input and feedback on your experiences today to make sure we can bring that forward now as we move along our transition to the HIMSS network. We are always so incredibly grateful to hear from you, to learn from you. I cannot thank you enough for spending this much time online with us today, sharing your insights and experience, and I hope you'll continue to do that. We will be counting on you to work with us, bring this incredible, rich and robust knowledge and experience to our work with the HIMSS network as we bring forward all the many important opportunities to drive and accelerate the digital infrastructure and transformation of supply chain and global health systems worldwide. So with that, that concludes the Path Forward 2020. I wish you all an incredibly safe and healthy and happy holiday season, even though it has many constraints around it. The tremendous resilience I know everyone and we have seen to date in this pandemic will carry us through into a new year filled with much promise. So stay well, and thank you all very, very much for joining us today.